Today we will learn about Stridor in brief. So it is a high-pitched, wheezing sound, and it is caused by um, disrupt airflow, disrupt airflow because of blockage or narrowing of the airflow or the airway. That is larynx, something going on in the larynx or the windpipe, the trachea, or it can be bronchi. And this disrupted airflow, and it can be heard, the wheezing sound can be heard usually during inhalation. Okay, and because I said narrowing, it can be because of narrowing, because children have more narrow airways, so it is more common in children. And the common causes, maybe because of like foreign bodies, foreign body, or any infections, or any allergens, or if you have any congenital abnormality. Any congenital abnormality, and it's also considered a medical emergency. And the diagnosis, the first step is, of course, the physical examination or imaging, and endoscopy is also sometimes done. So the treatment, look, the causes, you can remember the treatment as well. So it focuses mainly on the underlying cause. If you have any underlying issue because of which you're having this condition, Stridor. So underlying cause, or which may be because of any medicines that you're taking. And we also might use some steroids or bronchodilators. Surgery is not common. That's it. Thank you.